What is the best crutch gait to use if a patient is not permitted to put any weight on their left leg? A. Swing through. B. 2-point. C. 3-point. D. 4-point. When a patient is about to go into shock, what posture should you put him in? A. Trendelenburg. B. Flat, supine. C. Semi-Fowlers. D. Reverse Trendelenburg. If an Orthodox Jewish patient won't use the call bell or answer the intercom because they won't use electrical appliances on the Sabbath, shouldn't the nurse? A. Provide him with a handbell or alternate means of calling the nurse. B. Check on him every 15 to 30 minutes. C. Advise him that he is putting himself at risk. When determining the burden of proof for acts of negligence, how would risk management classify willfully providing inadequate care while disregarding the safety and security of another? A. Comparative negligence. B. Gross negligence. C. Negligent conduct. At which time of day are patients with cognitive impairment usually most sensitive to sensory overload? A. Late evening. B. Noon. C. Afternoon. D. Early morning. Which of the following is characteristic of nociceptive pain? A. Burning, stabbing, or shooting pains. B. Diffuse or cramping pain. C. Acute aching or throbbing pain localized to the site of injury. D. Association with chronic conditions such as diabetes or cancer. An Alzheimer's patient is actively resistive to basic hygiene. However, in order to meet basic standards for hygiene, how frequently should the patient be bathed? A. Biweekly. B. Weekly. C. 2 to 3 times weekly. Which of the following is a legal document that specifically designates someone to make decisions regarding medical and end-of-life care if a patient is mentally incompetent? A. Do not resuscitate order. B. General power of attorney. C. Durable power of attorney. Which type of precautions is indicated for a patient with a surgical site infection and purulent discharge? A. Contact and droplet. B. Airborne. C. Droplet. D. Contact. According to the 3-step World Health Organization, WHO, analgesic ladder. A patient complaining of moderate to severe pain unresponsive to NSAIDs may require which of the following medications? A. Morphine. B. Demerol. C. Codeine. According to Maslow's hierarchy of needs, which of the client's needs must be met first? A. Belonging and self-esteem. B. Physiological. C. Safety and security. D. Self-actualization. Which of the following injection sites is the best choice for intramuscular IM administration of 3 milliliters of medication for a well-developed adult female of normal weight? A. Deltoid. B. vastus lateralis. C. Ventrogluteal site. Which of the following terms is used to describe the biological effects of drugs over time? A. Half-time. B. Pharmacokinetics. C. Effect site equilibrium. D. Pharmacodynamics. A bed-bound patient has a 1.5-inch foam overlay over her mattress. The nurse places her hand under the overlay and finds that the foam overlay has compressed to 0.75 inches. What does this indicate? A. Excess wear. B. Adequate support. C. Bottoming out. A client receiving hydrochlorothiazide is instructed to increase her dietary intake of potassium. The best snack for the client requiring increased potassium is A. Pear. B. Apple. C. Avocado. The nurse is caring for a client following the removal of the thyroid. Immediately post-op, the nurse should A. Maintain the client in a semi-Fowler's position with the head and neck supported by pillows. B. Encourage the client to turn her head side to side to promote drainage of oral secretions. A client hospitalized with chronic dyspepsia is diagnosed with gastric cancer. Which of the following is associated with an increased incidence of gastric cancer? A. Dairy products. B. Carbonated beverages. C. Luncheon meats. A client is sent to the psychiatric unit for forensic evaluation after he is accused of arson. His tentative diagnosis is antisocial personality disorder. In reviewing the client's record, the nurse would expect to find A. A history of consistent employment. B. A below-average intelligence. C. A history of cruelty to animals. The licensed vocational nurse may not assume the primary care for a client. A. In the 4th stage of labor. B. 2 days post-appendectomy. C. With a venous access device. D. With bipolar disorder. The physician has ordered dressings with sulfamylene cream for a client with full-thickness burns of the hands and arms. Before dressing changes, the nurse should give priority to A. Administering pain medication. B. Checking the adequacy of urinary output. C. Requesting a daily complete blood count. The nurse is teaching a group of parents about gross motor development of the toddler. Which behavior is an example of the normal gross motor skill of a toddler? A. She can pull a toy behind her. B. She can copy a horizontal line. C. She can build a tower of 8 blocks. A client hospitalized with a fractured mandible is to be discharged. Which piece of equipment should be kept on the client with a fractured mandible? A. Wire cutters. B. Oral airway. C. Pliers. The nurse is to administer digoxin elixir to a 6-month-old with a congenital heart defect. The nurse auscultates an apical pulse rate of 100 beats per minute. The nurse should A. Record the heart rate and call the physician. B. Record the heart rate and administer the medication. C. Administer the medication and recheck the heart rate in 15 minutes. A mother of a 3-year-old hospitalized with lead poisoning asks the nurse to explain the treatment for her daughter. The nurse's explanation is based on the knowledge that lead poisoning is treated with A. Gastric lavage. B. Chelating agents. C. Antiemetics. An 18-month-old is scheduled for a cleft palate repair. The usual type of restraints for the child with a cleft palate repair are A. Elbow restraints. B. Full arm restraints. C. Wrist restraints. A client with glaucoma has been prescribed Timoptic, timolol, eye drops. Timolol should be used with caution in the client with a history of A. Benign prostatic hyperplasia. B. Gastric ulcers. C. Diabetes mellitus. Which of the following is a common complaint of the client with end-stage renal failure? A. Weight loss. B. Itching. C. Ringing in the ears. D. Bruising. Which of the following medication orders needs further clarification? A. Darvocet 65 mg POQ4, 6 hours PRN. B. Nembutal 100 mg PO at bedtime. C. Coumadin 10 mg PO. D. Estrace 2 mg POQ day. Angela has been experiencing tinnitus, vertigo, and ear stuffiness caused by Meniere's disease. The following food items she is discouraged to eat, except A. Green tea. B. Unsalted pretzels. C. Grapefruit. Which of the following findings is associated with right-sided heart failure? A. Shortness of breath. B. Nocturnal polyuria. C. Daytime oliguria. D. Crackles in the lungs. An 8-year-old admitted with an upper respiratory infection has an order for O2 saturation via pulse oximeter. To ensure an accurate reading, the nurse should A. Place the probe on the child's abdomen. B. Calibrate the oximeter at the beginning of each shift. C. Place the probe on the child's finger. An infant with tetralogy of Fallot is discharged with a prescription of Lanoxin elixir 0.5 ml once a day PO. The nurse should instruct the mother to A. Administer the medication using a nipple. B. Administer the medication using the calibrated dropper in the bottle. C. Administer the medication using a plastic baby spoon. The client scheduled for electroconvulsive therapy tells the nurse, "I'm so afraid. What will happen to me during the treatment?" Which of the following statements is most therapeutic for the nurse to make? A. You will be given medicine to relax you during the treatment. B. The treatment will produce a controlled grand mal seizure. Which of the following skin lesions is associated with Lyme's disease? A. Bullseye rash. B. Spider veins. C. Bully. D. Scaly, silvery skin patches. Which of the following snacks would be suitable for the child with gluten-induced enteropathy? A. Ice-cold ale. B. Pumpkin loaf cake. C. Buckwheat kasha. D. Oatmeal cookies. A client with schizophrenia is receiving thorazine, chlorpromazine, 400 mg twice a day. An adverse side effect of the medication is A. Photosensitivity. B. High fever. C. Weight gain. Which information should be given to the client taking Dilantin, phenytoin? A. Taking the medication with meals will increase its effectiveness. B. The medication decreases the effects of oral contraceptives. C. More frequent dental appointments will be needed for special gum care. A client with a history of emboli is receiving Lovenox, enoxaparin. Which drug is given to counteract the effects of enoxaparin? A. Methergine. B. Protamine sulfate. C. Calcium gluconate. Long-term usage of corticosteroids or antibiotics raises the risk of A. Candidiasis. B. Anaphylaxis. C. Gingivitis. D. Constipation. Drooling is prolonged and swallowing is impeded in stroke patients with right-sided paralysis. What kind of suctioning is recommended? A. Oropharyngeal. B. Nasopharyngeal. C. Tracheal. A patient has experienced 48 hours of acute vomiting and watery diarrhea. Which electrolyte imbalance is most likely to happen when vomiting and diarrhea are persistent? A. Hypocalcemia. B. Hypernatremia. C. Hyponatremia. To what temperature should ground beef be cooked to avoid food poisoning? A. 180 degrees Fahrenheit. B. 160 degrees Fahrenheit. C. 140 degrees Fahrenheit. D. 125 degrees Fahrenheit. An example of this is the nurse's capacity to pay attention to a patient, pick up on their emotions, and comprehend their viewpoints. A. Compassion. B. Sympathy. C. Empathy. The most frequent cause of bacterial food poisoning in patients who show symptoms within 30 minutes of eating is A. Clostridium botulinum. B. Staphylococcus aureus. C. Clostridium perfringens. D. Salmonella typhimurium. What drug is most likely to offer relief right away if an asthmatic patient is having an acute exacerbation with wheezing and dyspnea? A. Ipratropium, anticholinergic. B. Albuterol, beta-adrenergic agonist. C. Prednisone, corticosteroid. What should the nurse do first if she gives a medication to the wrong patient? A. File an incident report. B. Notify the physician. C. Notify the supervisor. D. Assess the patient for an adverse reaction. During the client's medical records review, what condition can put the client at risk for developing hypokalemia? A. Has a history of Addison's disease. B. Nasogastric suction. C. Burn. D. Uric acid level of 10.2 mg dl, 59.48 mol L. The nurse analyzes the electrolyte test results for a client and notes that the potassium level is 2.2 milliequivalent L, 2.2 mol L. Based on the laboratory result, which ECG pattern is not expected? A. Absent P waves. B. Depressed ST segment. C. Inverted T waves.